Good evening. I am Dr. DrUjjalChatterjee from Siliguri. My today's topic is on a very important illness, typhoid fever. You all know about this disease. We also call it enteric fever. When I say enteric fever, it means it is a disease related to intestine. So this is purely an intestinal infection caused by a bacteria named Salmonella typhi. How it happens? You should know this is purely a water and foodborne disease. When you take contaminated food or drinking water from outside, like street food or food from an open source like melas, there is a fair chance that we will have this disease. Sometimes we get history of travel. क्या होता है? खाना का साथ, पानी का साथ, bacteria goes to the intestine and infects the intestinal wall, and subsequently the disease occur. It may take 7 days to manifest all the symptoms. Now what happens? Usually it starts with very high fever, with severe headache, vomiting tendency, constipation, pain abdomen, subsequently watery loose stool. Fever may reach up to 104 and 105 degree Fahrenheit, and it is continuous in nature. That means it never touches the baseline in spite of anti-fever medicines like paracetamol or others. Now how to prevent? इंडिया में 9 महीने से बच्चे लोग को टाइफाइड वैक्सीन लगाया जाता है. इन माई ओपिनियन दिस इज वन ऑफ द मोस्ट इम्पॉर्टेंट वैक्सीन्स विच यू शुड नॉट मिस, बिकॉज if typhoid occurs in early childhood, it can affect your child in many ways. ये छोड़ के you should avoid contaminated drinking water or food to your child while you travel, or you go to some open areas like Mela or some other places. Now, regarding investigation and treatment. One thing you should know, typhoid is such a disease, you should not do anything on your own at home. You should consult your child specialist regarding investigation to be done and treatment to be done. What we do, we usually prescribe blood test routine as well as Typhoid. Typhoid is one of the most important investigation, and it is more or less specific for typhoid fever. If typhoid become positive, we can give antibiotics like cefixime, quinolones, azithromycin, either singly or in combination. If the child condition is not that bad, if with this medicine child become all right within next 3 to 5 days, 7 days, it's okay. You should continue antibiotic for 5 days even after full remission of fever. This is important. Sometimes you don't do that because you think अरे बुखार तो ठीक हो गया, अभी क्यों एंटीबायोटिक दे? नो, बिकॉज relapse of typhoid is very bad and very difficult to treat. So remember this. You should continue for another 5 days after remission. Suppose after 5 days of treatment आपका बच्चा का बुखार नहीं उतरा, other complications are appearing like severe headache, irritability, child is not taking any food, not even drinking water, you should admit your child under care of your child specialist in a hospital, because in that case your child will require intravenous antibiotic and intravenous fluid. Here also you have to treat your child for another 3 to 5 days after remission of fever. Regarding food, this is an intestinal disease, so easily digestible food देना है. You can give soft rice, dal ka pani. Only milk product you can give is curd. You can give barley. You can give any rice product like chura, muri, etc. You can give fruits, fruit juice also you can give. In case of non-vegetarian patients, you can add fish or chicken stew. What not to do, give. Try to avoid milk and wheat product, and don't give leafy vegetables. Lastly, I should say one thing. If typhoid is not diagnosed in proper time and not treated for a proper period with proper antibiotic, there may be complications of typhoid fever. In earlier days, we used to get intestinal perforation in typhoid fever. मतलब खाद्य नाली में होल हो जाता था. It usually occurred after 2 weeks of fever. And at that time, अच्छा दवा भी नहीं मिलता था. Nowadays, we don't get this type of complication, as आजकल पेरेंट्स लोग बहुत जल्दी डॉक्टर के पास लेके जाता है. So thank you for your patient hearing. সবাই ভালো থাকবেন, সুস্থ থাকবেন. নমস্কার.